Hello everyone. Welcome to our presentation in Schneider Go Green 2022. Our project is Medico, a conversational AI-based medicine tracking system. This system works by enabling the virtual home assistant to store and also to track medicinal data. The team members are Krishna Ranjini and Harshi. Our team is called Mission X. The problem statement that we have worked on is an AI-based medicinal tracking and supply system. Medicinal drugs have become part of our daily lives. Managing the medication is really hard. For people who are taking medicines, organizing them, remembering everything is a huge challenge. Patients find it very difficult to keep track of their medication at the right time and in the right proportion. As we can see here, children at the age of 11 years and below were under daily medication for various conditions like asthma, penicillin, and their daily vitamin supplements. The people aged between 12 to 19 years were under medication for nervous system stimulants and oral contraceptives like birth control and menstrual regulators. People aged between 20 to 50 years consumed antidepressants, medicines for chronic diseases, and much more. A recent survey has proved that over 78% of the total human community was taking medications for specific conditions. Following this, around 50% of these patients either skipped their medicines or did not take them on the right time. Procrastination of medicinal drugs kills almost 2 lakh people every year on this planet, and as many as 23% of the total patients were hospitalized every year due to procrastination. We need to find a solution to guide the medicinal supply and track medicine intake. So, we fix this problem by introducing an AI-based medicinal drug tracking system. The drugs prescribed to the patients are intended to prevent medicinal complications or reduce hospitalization. But even when the risks are high, many patients do not take their medications. There are some serious issues with the current drug supply and tracking. We have addressed the same in our presentation. Medicine non-adherence. This happens when patients do not take their medications as prescribed. So patients with Alzheimer's disease and people who suffer from emotional problems like anxiety and depression, they are less likely to take their medications as prescribed, and this results in non-adherence. This is a severe issue. It affects the patients directly by delaying the curing time and even resulting in death. Research has proved that 75% of people do not consume their medication properly as prescribed, and around 20 to 30% of patients never refill their medication. There is another severe issue among elderly people. In this case, if a prescription is too hard to understand, they might get confused, resulting into consuming the wrong medication, which can cause serious issues. Our problem statement mainly deals with medicine tracking and supply. However, ever since the coronavirus pandemic has hit us, the need for remote patient monitoring has tremendously increased. So, that's why we propose a conversational AI-based drug monitoring system. This will help remote patient monitoring and promote patient-centric approaches. The main aim of our project is to supply and monitor drugs with the help of a virtual home assistant, which can enable medical interactions. In the future, voice assistants will play an essential role in our daily lives. Hence, we decided to convert these virtual home assistants into medicine storage devices to effectively track the medicinal consumption of the patient. Over the past few years, people find it more convenient to use AI-based home assistants in their daily lives. Virtual assistants, voice services, they can communicate with people easily and get smarter over time through the voice user interface system. Nearly 38% of the people already own a voice assistant, and 1/3, that is around 33% of the total population, plans to purchase one within the next 3 years. This demonstrates the popularity of AI devices. This way of human-computer interaction makes medicine monitoring easier, and it can also be accessible to people easily. The heart of our proposed system is the storage and weighing section. We have proposed a compact prototype. This will get attached to the home assistant. Most of the time, it will serve as a smart home assistant, but whenever the medication is due, it will remind the user about the medication. After reminding, the device will keep a track on the weight scale. This is done to get a confirmation on the taking of the medicine. So whenever you take a dose, you just need to click on the medicine button. This button is present on the top of the device. On click, this will give you the allocated medicines as prescribed. Below the storage unit, a strain gauge would be placed. This would be sensitive to the weight changes when the user takes the medicines. Once the weight of the medicine is reduced from the storage cell, this will indicate that your medicine is taken. No extra efforts are required. We have designed the prototype to store medicines separately in each section. By this way, the medicines can be segregated and loaded in the device, also managing medication intake. This will also help us to train the virtual assistant based on the prescribed timings. The pill box would contain the prescribed dosage for the prescribed timings and would be inserted in each compartment or section. The medicine segregation is enabled by the scannable tags that are present in the pill box. The patient can scan the QR code on a medication package to record the medication data of each section. After scheduling your medication, the medicine box is inserted inversely into the storage section. This will help us to provide the required medicines on the right time. If a person takes multiple doses each day, then we can store the medication in separate sections. The weighing section will continuously monitor the weight of the medicines on each section separately. If the medicine timing is due, it will check for the weight of that section. And suppose the section's weight is not reduced according to the dosing schedule, now in such a scenario, it will provide clear audio alerts whenever something is due. Our device is designed to simplify and improve your existing habits. Once you intake your medication, the device will record the intake details and timings. There will also be an interaction to know your health and mental status, which will be stored in the cloud storage. Using this data, the virtual assistant system can remind about the medicinal timings and the need to refill or renew a prescription for a patient and a caregiver. This also provides a detailed health report for the entire duration and gives access to remote patient monitoring. Let us now take a view on how Medico works. Primarily, the device is trained with the prescribed medicines and their timing details. When it's time for the patient to take the medication, the device will alert the user and keep a track of the medicinal weight. After a certain time interval, it will re-notify the user if the medicine is not taken. When the patient takes medicine, the voice assistant questions the patient regarding their health condition and stores the data as a detailed report, along with the other details like medicine consumption time and consumed medicine. Virtual assistants can enhance medical care and outcomes by periodically asking patients about their health conditions. This data can then be surfaced and stored to monitor the patient's well-being. In addition, reports for the same can be generated to analyze the patient's condition over a span of time. If the patient needs a refill, the system automatically checks whether the patient needs a refill or medical visits and book accordingly. Our proposed solution would work as a pill organizer and provide interactive voice-based alerts. It would also aid in keeping track of their medicine and prevent missing doses or overdoses. The interaction between human and the computer would be improved with the voice user interface system, making the user feel more comfortable. In addition, our proposed device will be extremely easy to handle and aid in promoting the patients to follow their daily medication. Further to this, it can also provide voice-based reminders to these patients for the medical appointments or routine checkups. Healthcare providers can also use this device to assist their patients in complying with their medical regimen. In our project, blister packing is replaced by pill boxes. They can carry the medicinal information and refill times. In addition to it, pill boxes can be refilled easily. The issue with blister packing is that it costs a lot to recycle. Hence, our proposed solution would also help reduce blister packaging for medicines and reduce the medicinal cost. We will now look at the timeline to demonstrate our project status. The prototype development of our project idea will be completed by April. We will then develop the virtual assistant in the month of May. The final prototyping of our project Medico will be developed and tested in the month of June. The potential usage of our proposed solution is enormous, and here we have outlined the benefits as well as the key stakeholders that would benefit from our solution. Our proposed system emphasizes the patient-centric approach with the goal of increasing patient involvement and promoting positive viability such that they will adhere to their prescribed medical regimen. As a result of this approach, patients are more likely to engage in care and treatment, also have lesser symptoms and have a lower chance of being readmitted to the hospital for the same reason. The suggested solution takes into account an HCI viewpoint to the design of this smart healthcare equipment, and a strong HCI design improves both usability and utility. The suggested interactive system provides a solution by delivering medication to the patients in a patient-centric, safe, secure, routine, and monitored manner. This proposed solution would also be very affordable to all the users. Medical adherence is a major factor in any treatment's success. Medication non-adherence in patients results in significant illness deterioration, mortality, and higher healthcare expenses. As a result, we have implemented appropriate techniques to promote and maintain drug adherence. This proposed solution can help healthcare professionals, paramedics, and hospitals to guide patients to obtain the best possible health status with reasonable resource utilization. Our team, Mission X, consists of two ambitious students, Krishna Ranjini and Harshi. Our expertise lies in artificial intelligence and machine learning. Thank you.